Now, the Health Secretary has announced extra money for GP practices in England, which he says will help make it easier for people to book appointments. Now, Steve Barclay says the £240 million of funding will enable surgeries to obtain the latest technology and end the 8 a.m. scramble for GP appointments.
Hang on a minute. Millions of patients are waiting more than 2 weeks for an appointment with an exhausted GP. Millions of GP appointments now last under 5 minutes due to the crippling shortages of GPs. And having repeatedly failed to hit its recruitment target for GPs, the government's solution is to give them all a new telephone so they can let patients know more quickly there won't be anyone available to see them for a couple of weeks. Who came up with this absolute bollocks? The simple fact is, despite promising to recruit 5,000 more GPs in their 2015 manifesto and 6,000 more in their 2019 manifesto, there are now 2,000 fewer full-time, fully trained GPs today than we had in 2015. Don't just take my word for it. Listen to Dr. Steve Taylor, a GP and spokesperson for the Doctors Association, speaking to Sky News on 8th of May.
I'm not sure why the government are using this as a smokescreen, I think would be the best way of putting it, really. I think reality is they promised in 2015 there'd be 5,000 more doctors by 2020. There are actually 2,000 less now than there were in 2015, and that was Jeremy Hunt, who's our current Chancellor of the Exchequer.
Never underestimate just how thick this government thinks we all are, and it gets worse.
This year, general practice received 2.7% uplift.
Well, here's Chancellor Jeremy Hunt with an update on inflation under this government.
The Bank of England's inflation target is 2%, but currently inflation is about 10%. That means more expensive food, fuel.
So the government gives GP practice a 2.7% uplift to cover a 10% increase in bills. I'll give the final word on all this to Dr. Steve Taylor.
I think a vast number of practices have already got much of this technology in place already. Certainly my practice that I've worked in, we've had it for 5 or 6 years, and the practice I'm registered with has also got it as well. I think we all know that the real problem is there just aren't enough doctors. So whether you get through at 8, 6, 4, whatever time of day, there just aren't enough appointments. Actually, all of us know that the real issue is we need staff. We don't need phone lines. So if you can get through quickly and then book an appointment with a person that you can see or speak to, then that's far, far more important. So they know the problem and they know what the issue is, but they're not really creating solutions to that problem. I think we all know that we all would love to be able to see a GP. Frankly, I'm a doctor that, I, like everyone else, I'm a patient, and I was number 31 in the queue 2 weeks ago. And none of us wants that, and no GP in the country wants that. And yet, for some reason, I've no idea why, the government don't appear to be wanting to listen to those that actually do the work.